Welcome to Executive Order Watch.
The immigrants have arrived.
I know. I have the package.
Documentary evidence of citizenship. Section 1903 of the Social Security Act is amended by striking under clauses and of Section 1137 and inserting under Section 1137 by inserting except that the state shall not be required to make medical assistance available to such individual during the period in which such individual is provided such reasonable opportunity if the state has not elected the option under Section 1902 before the period at the end. As Social Security data match, Section 1902 of the Social Security Act is amended in paragraph in subclause by striking and inserting, and if the state has elected the option under subsection, continues to provide the individual with medical assistance during such 90-day period. And 303 in subclause by inserting or denies eligibility for medical assistance under this title for such individual as applicable after under this title. And in paragraph, individuals with satisfactory ME. Section 1137 of the Social Security Act is amended by striking under clauses of Section 1137 and inserting under Section 1137, and by inserting except that the state shall not be required to make medical assistance available to such individual during the period in which such individual is provided such reasonable opportunity if the state has not elected the option under Section 1902 before the period at the end. In subparagraph by inserting except that such prohibition on delay, denial, reduction, or termination of eligibility for benefits under the Medicaid program under Title XXX shall apply only if the state has elected. 304. The option under Section 1902 after 1 as has been provided, and 2. In subparagraph, by inserting 3 after 8 status 9, PM 811, 12. Section 1902 of the So 13 Shall Security Act is 14 amended 15. In subparagraph by striking 16 and at the end 17. In subparagraph by adding 18 and at the end and 19. By inserting after subparagraph 20 the following new subparagraph 21. Provide at the option of the state for 22 making medical assistance available 23. To an individual described in subpara 24 graph during the period in which such ND 25. 305. Individual is provided the reasonable opportunity to present satisfactory documentary evidence of citizenship or nationality under subsection or Section 1903 or during the 90-day period described in subsection. To an individual who is not a citizen or national of the United States during the period in which such individual is provided the reasonable opportunity to submit evidence indicating a satisfactory immigration status under Section 1137. Section 2105 of the Social Security Act is amended by adding at the end the following new subparagraph. Option to continue providing child health assistance during reasonable opportunity period. Section 1902 shall apply to states under this title in the same manner as it applies to a state under Titlex. ED. The amendments made by this section shall apply beginning October 1st, 2026. 306. SEC 44,111. Reducing expansion FMAP for certain one states, providing payments for health to care furnished to certain individuals. 3. Section 1905 of the Social Security Act is amended. 5. In subsection. In paragraph, by inserting after thereafter, and in paragraph, by adding at the end the following new subparagraph. The term specified state means with respect to a quarter a state that provides any form of financial assistance during such quarter, in whole or in part, whether or not made under a state plan under this title or under another program established by the state, and regardless of the source of funding for such assistance, to or on behalf of an alien who is not a qualified alien for the purchasing of health insurance coverage, as defined in Section 307. 2791 of the Public Health Service 1 Act, for an alien who is not a qualified 2 alien, or 3. Provides any form of comprehensive health benefits coverage during such quarter, whether or not under a state plan under this title or under another program established by the state, and regardless of the source of funding for such coverage, to an alien who is not a qualified alien. Immigration terms. A. The term alien has the meaning given such term in Section 101 of the Immigration and Nationality Act. Q. Qualified alien. The term qualified alien has the meaning given such term in Section 431 of the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, except that the reference to at the time the alien applies for, receives, or attempts to receive a federal public benefit in subsection of such section shall be treated as a reference to. 308. At the time the alien is provided comprehensive health benefits coverage described in clause of Section 1905 of the Social Security Act, or is provided with financial assistance described in clause of such section, as applicable. The references to in subsection of such section shall be treated as references to. In subsection. In subparagraph. In the matter preceding subclause. By striking for a year and inserting for a calendar quarter in a year. And in subparagraph, by striking for such year and inserting for such quarter. And 309. In subclause, by striking for 1 the year and inserting for the quarter 2 for the state. 3 subpart B, preventing wasteful spending for SEC. 44121. Moratorium on implementation of Rule 5 relating to staffing standards for 6 long-term care facilities under the 7 Medicare and Medicaid programs. The Secretary of Health and Human Services shall 9 not during the period beginning on the date of the enactment of this section and ending January 1st, 2035, implement, administer, or enforce the provisions of the Final 12 Rule published by the Centers for Medicare and Medicaid 13 Services on May 10th, 2024, entitled Medicare and Med 14 Medicaid Programs. Minimum staffing standards for long 15-term care facilities and Medicaid institutional payment, 16 transparency reporting. 17 SC 4422, modifying retroactive coverage under 18 the Medicaid and CHIP programs. IG Section 1902 of the Social Security Act is amended 21 by striking him and inserting the Indy 22 visual. 23. By striking the 3rd month and inserting 24 the month. 25. 310. By striking he and inserting the Indy 1 visual. And 2. By striking his and inserting the individ 3 yules. DMA, Section 5-1905 of the Social Security Act. 6 is amended by striking in or after the third month, before 7 the month in which the recipient makes application for aid assistance, and inserting in or after the month before 9, the month in which the recipient makes application for 10 assistance. Section 2102 of the Social Security Act is amended 13. In clause by striking and at the end 14. In clause by striking the period and in 15 inserting and in 16. By adding at the end the following new 17 clause. 18 shall, in the case that the state 19 elects to provide child health or pregnancy, 20 related assistance to an individual for any 21 period prior to the month in which the N22 individual made application for such assist 23 ants, provide that such assist 25. 311. Ants is not made available to such individual items and services, included 2 under the state child health plan that are furnished before 4 the month preceding the month in which 5 such individual made application for such assistance. ED. The amendments made by 9 this section shall apply to medical assistance and child 10 health assistance and pregnancy-related assistance, with 11 respect to individuals whose eligibility for such medical as 12 assistance, child health assistance, or pregnancy-related as 13 assistance is based on an application made on or after Octo 14/1, 2026. 15 SC 41-3. Ensuring accurate payments to FAR 16 Macy's under Medicaid. 17. IG, Section 1927 of the Social Security Act is amended 19. In paragraph 20, by redesignating clauses Clause 21 and 22, by striking and, after the semicolon 23 at the end of clause, and all that precedes it 24 through, and inserting the following 25. 312. Determining pharmacy actual acquisition. The Secretary shall conduct a survey of retail community pharmacy drug prices and applicable non-retail pharmacy drug prices to determine national average drug acquisition cost benchmarks as follows. The Secretary may contract services for the determination of survey prices separate from the survey prices. With respect to retail community pharmacies, the determination of retail survey prices of the national average drug acquisition cost for covered outpatient drugs that represent a nationwide average of consumer purchase prices for such drugs, net of all discounts, rebates, and other price concessions based on a monthly survey of such pharmacies. With respect to applicable non-retail pharmacies, 313, described in clause of the non-retail national average drug acquisition cost for covered outpatient drugs that represent a nationwide average of consumer purchase prices for such drugs, net of all discounts, rebates, and other price concessions based on a monthly survey of such pharmacies, and 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. At the discretion of the Secretary. For each type of applicable non-retail pharmacy, the determination of survey prices. Separate from the survey prices described in clause or subclause of this clause, of the national average drug acquisition cost for such type of pharmacy for covered outpatient drugs that represent a nationwide average of consumer purchase prices for such drugs, net of all discounts, rebates, and other price concessions to the extent any. 314. Information with respect to such discounts, rebates, and other price concessions is available based on a 3-monthly survey of such pharmacies, 4 and 5. in subparagraph of paragraph by 6, striking subparagraph and inserting sub 7 paragraph 8. In subparagraph of paragraph by 9, striking clauses and inserting the full 10 allowing. The vendor must update the SEC 12 retary no less often than monthly on the 13 survey. Prices for covered outpatient drugs. The vendor must differentiate. 15, in collecting and reporting survey data. For 16, all cost information collected. Whether a 17 pharmacy is a retail community pharmacy, 18, or an applicable non-retail pharmacy. In 19, including whether such pharmacy is an AFL 28, 21, and in the case of an applicable non-retail 22 pharmacy, which type of applicable non-re 23 tail pharmacy it is using the relevant FAR 24 Macy type indicators included in the GID 25. 315. Ants required by subsection of Sec 1 Shin 4123 of the Act, titled an Act to provide for reconciliation pursuant to Title 3.2 of H. Con. Res. 14. 4, by adding at the end of paragraph the 5 following 6, 7, 8, 9. Survey reporting. In order to meet the requirement of Section 1902, a state shall require that any retail community pharmacy or applicable non-retail pharmacy in the state receives any payment, reimbursement, administrative fee, discount, rebate, or other price concession related to the dispensing of covered outpatient drugs to individuals receiving benefits under this title, regardless of whether such payment, reimbursement, administrative fee, discount, rebate, or other price concession is received from the state or a managed care entity or other specified entity, directly or from a pharmacy benefit manager or another entity that has a contract with the state or a managed care entity or other specified entity, shall 316. Respond to surveys conducted under this paragraph. Survey information. Information on national drug acquisition prices obtained under this paragraph shall be made publicly available in a form and manner to be determined by the Secretary, and shall include at least the following: the monthly response rate to the survey, including a list of pharmacies not in compliance with subparagraph, the sampling methodology and number of pharmacies sampled monthly, information on price concessions to pharmacies, including discounts, rebates, and other price concessions, to the extent that such information may be publicly released and has been collected by the Secretary as part of the survey. I subject to clauses. And the Secretary shall enforce the provisions of this paragraph with respect to a pharmacy through the establishment of civil money penalties applicable. 317. Basis for penalties. The Secretary shall impose a civil money penalty established under this subparagraph on a retail community pharmacy or applicable non-retail pharmacy if the retail pharmacy or applicable non-retail pharmacy refuses or otherwise fails to respond to a request for information about prices in connection with a survey under this subsection, knowingly provides false information in response to such a survey, otherwise fails to comply with the requirements established under this paragraph. Parameters for pen. A civil money penalty established under this subparagraph may be assessed with respect to each violation, and with 318. Respect to each non-compliant retail community pharmacy or non-compliant applicable non-retail pharmacy in an amount not to exceed $100,000 for each such violation. C. In determining the amount of a civil money penalty imposed under this subparagraph, the Secretary may consider the size, biz structure, and type of pharmacy involved, as well as the type of violation and other relevant factors, as determined appropriate by the Secretary. Rule of application. the provisions of Section 1128A and shall apply to a civil money penalty under this subparagraph in the same manner as such provisions apply to a civil money penalty or proceeding under Section 1128A. 319. A limitation on use of applicable retail pharmacy pricing informa. No state shall use pricing information reported by applicable non-retail pharmacies under subparagraph to develop or inform payment methodologies for retail community pharmacies. In subparagraph. By inserting, including payment rates and methodologies for determining ingredient cost reimbursement under managed care entities or other specified entities, after under this title. In subparagraph by inserting and the basis for such dispensing fees before the semicolon. By redesignating paragraph as paragraph. By inserting after paragraph the following new paragraph. The Inspector General of the Department of Health and Human Services shall conduct periodic studies of the survey. 320. Data reported under this subsection, as appropriate, including with respect to substantial variations in acquisition costs or other applicable costs, as well as with respect to how internal transfer prices and related party transactions may influence the costs reported by pharmacies that are affiliates or are owned by, controlled by, or related under a common ownership structure with a wholesaler, distributor, or other entity that acquires covered outpatient drugs relative to costs reported by pharmacies not affiliated with such entities. The Inspector General shall provide periodic updates to Congress on the results of such studies, as appropriate, in a manner that does not disclose trade secrets or other proprietary information. A. There is appropriated to the Inspector General of the Department of Health and Human Services, out of any money in the Treasury not otherwise appropriated, $5 million for fiscal year 2026, to remain available until expended, to carry out this paragraph. And 321. By inserting an $8 million for each of fiscal years 2026 through 2033 after 2010, and by inserting funds appropriated under this paragraph for each of fiscal years 2026 through 2033 shall remain available until expended after the period. Section 1927 of the Social Security Act is amended in the matter preceding paragraph by striking in the section and inserting in the section, by adding at the end the following new paragraphs. Applicable non-retail pharmacy. The term applicable non-retail pharmacy means a pharmacy that is licensed as a pharmacy by the state and that is not a retail community pharmacy, including a pharmacy that dispenses prescription medications to patients primarily through mail and specialty pharmacies. Such term does not include nursing home pharmacies, long-term care facility pharmacies, hospital pharmacies, clinics, charitable or not-for-profit pharmacies, government pharm. 322. Macy's or low dispensing pharmacies. A. The term affiliate means any entity that is owned by, controlled by, or related under a common ownership structure with a pharmacy benefit manager or a managed care entity or other specified entity. ED. IN generous seg to paragraph. The amendments made by this section shall apply beginning on the first day of the first quarter that begins on or after the date that is 6 months after the date of enactment of this section. D. Late application to applicable retail pharmacies. The pharmacy survey requirements established by the amendments to Section 1927 of the Social Security Act made by this section shall apply to retail community pharmacies beginning on the effective date described in paragraph but shall not apply to applicable non-retail pharmacies until the first day of the first quarter that begins on or after the date that is 18 months after the date of enactment of this section. 323. Identification of ANP. IN General, not later than January 1st, 2027, the Secretary of Health and Human Services shall publish guidance specifying pharmacies that meet the definition of applicable non-retail pharmacies, as such term is defined in subsection of Section 1927 of the Social Security Act, as added by subsection, and that will be subject to the survey requirements under subsection of such section, as amended by subsection. Inclusion of pharmacy type indica. The guidance published under paragraph shall include pharmacy type indicators to distinguish between different types of applicable non-retail pharmacies, such as pharmacies that dispense prescriptions primarily through the mail and pharmacies that dispense prescriptions that require special handling or distribution. An applicable non-retail pharmacy may be identified through multiple pharmacy type indicators. Implementation of the amendments made by this section shall be exempt from 304. The requirements of Section 553 of Title V, United States I Code. And on application of PR 3A, Chapter 35 of Title 44. United States Code shall not apply to any data collection undertaken by the Sec. 5 Secretary of Health and Human Services under Section 6 Next 1927 of the Social Security Act 7 as amended by this section. 8 SC 44. Preventing the use of abusive spread 9 pricing in Medicaid. IG Section 927 of the Social Secu 11 RIDI Act is amended 12. In subsection, by adding at the end the 13 following new paragraph, 14. Transparent prescription drug pass, 15 through pricing required. 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. In general, a contract between the state and a pharmacy benefit manager, or a contract between the state and a managed care entity or other specified entity, and collectively referred to in this paragraph as the entity, that includes provisions making the entity responsible for coverage of covered out. 325. Patient drugs dispensed to individuals enrolled one with the entity shall require that payment for 2 such drugs and related administrative services 3. Including payments made by a 4 PBM on behalf of the state or entity, is based 5 on a transparent prescription drug pass 6 through pricing model, under which 7. Any payment made by the entity 8 or the PBM for such a 9 drug 10 is limited to 11 ingredient cost. And 12 a professional dis 13 pensing fee that is not less than 14. The professional dispensing fee 15 that the state would pay if the 16th state were making the payment 17 directly in accordance with the 18 state plan 19, 20, 21, 22, 23 is passed through in its entirety by the entity or PBM to the 326 pharmacy or provider that dispenses the drug and is made in a manner that is consistent with sections 447.502, 447.512, 447.514, and 447.518 of Title 42, Code of Federal Regulations, as if such requirements applied directly to the entity or the PBM, except that any payment by the entity or the PBM for the ingredient cost of such drug purchased by a covered entity may exceed the actual acquisition cost for such drug if such drug was subject to an agreement under Section 340B of the Public Health Service Act. Such payment for the ingredient cost of such drug does not exceed the maximum pay. 327. that would have been made by the entity or the PBM for the ingredient cost of such drug if such drug had not been purchased by such covered entity. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 25. Such covered entity reports to the Secretary on an annual basis and with respect to payments for the ingredient costs of such drugs so purchased by such covered entity that are in excess of the actual acquisition costs for such drugs, the aggregate amount of such excess payment to the entity or the PBM for administrative services performed by the entity or PBM is limited to an administrative fee that reflects the fair market value of such services the entity or the PBM makes available to the state. 328. The Secretary, upon request in a form and manner specified by the Secretary, all costs and payments related to covered outpatient drugs and accompanying administrative services incurred, received, or made by the entity or the PBM, broken down to the extent such costs and payments are attributable to an individual covered outpatient drug by each such drug, including any ingredient costs, professional dispensing fees, administrative fees, post-sale and post-invoice fees, discounts, or related adjustments such as direct and indirect remuneration fees, and any and all other remuneration as defined by the Secretary. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Any form of spread pricing whereby any amount charged or claimed by the entity or the PBM that exceeds the amount paid to the pharmacies or providers on behalf of the state or entity, including any post-sale or post-invoice fees, discounts, or related adjustments. 329. Such as direct and indirect remuneration fees or assessments, as defined by the Secretary, is not allowable for purposes of claiming federal matching payments under this title. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, covered entities described in sub-19 paragraphs through of such sec 20 shin. 21 covered entities described in 22 subparagraph of such section. 23. Covered entities described in 24 subparagraph of such section. 25. Publication of information. The Secretary shall publish, not less frequently than on an annual basis, and in a manner that does not disclose the identity of a particular covered entity or organization, information received by the Secretary pursuant to subparagraph that is broken out by state, and by each of the following categories of covered entity within each such state. Covered entities described in subparagraph of Section 340B of the Public Health Service Act. 330. Covered entities described in subparagraph of such section. Covered entities described in subparagraph of such section. In subsection, as previously amended by this subtitle, by adding at the end the following new paragraph. Pharmacy Benefit Manager. The term Pharmacy Benefit Manager means any person or entity that, either directly or through an intermediary, acts as a price negotiator or group purchaser on behalf of a state, managed care entity, or other specified entity, or manages the prescription drug benefits provided by a state, managed care entity, or other specified entity, including the processing and payment of claims for prescription drugs, the performance of drug utilization review, the processing of drug prior authorization requests, the managing of appeals or grievances related to the prescription drug benefits, contracting with pharmacies, controlling the cost of covered outpatient drugs, or the provision of services related thereto. Such term includes any person or entity that acts as a price negotiator with regard to payment amounts to FAR. 331. Macy's and providers for a covered outpatient drug or the net cost of the drug or group purchaser on behalf of a state, managed care entity, or other specified entity, or that carries out one or more of the other activities described in the preceding sentence, irrespective of whether such person or entity calls itself a pharmacy benefit manager. 1, 2, 3, 4, 5, 6, 7. CA Section 19038 of such act is amended 9. In paragraph 10. By striking and inserting 11, 12. By inserting before the period at the 13 and the following. And if the contract 14 includes provisions making the entity responsible 15 for coverage of covered outpatient drugs, the 16 entity shall comply with the requirements of 17 Section 1927 and 18 by moving the left margin 2 to the 19 left and 20 by adding at the end the following new 21 paragraph 22, 23, 24, 25. No payment shall be made under this title to a state with respect to expenditures incurred by the state for payment for services provided by an 332 other specified entity as defined in paragraph 1. Unless such services are provided in accordance with a contract between the state and such three entity which satisfies the requirements of paragraph 4. ED. The amendments made by 6 this section shall apply to contracts between states and 7 managed care entities, other specified entities, or FAR 8 Macy benefit managers that have an effective date begin 9ing on or after the date that is 18 months after the date 10 of enactment of this section. 11. I. Implementation of the 12 amendments made by this section shall be exempt from 13 the requirements of Section 553 of Title 5, United States 14 Code. 15. Plan and Application 6. Chapter 35 of Title 44. United States Code, shall 17 not apply to any data collection undertaken by the SEC 18 Retary of Health and Human Services under Section 1927 of the Social Security Act as amended by this section. 21. 333. SEC 44,125. Prohibiting federal Medicaid and CHIP 1 funding for gender transition pros 2 DERS for minors. M. Section 1903 of the Social Secu 4 RIDI Act is amended 5. In paragraph by striking or in 6 inserting a semicolon 7. In paragraph by striking the period at 8 the end and inserting 9. By inserting after paragraph the full 10 lowing new paragraph. 11 with respect to any amount expended for 12 specified or transition procedures, furnished to an individual under 14. 18 years of age enrolled in a state plan. And 16. In the flush left matter at the end by strict 17ing and inserting n. 18. Section 2107 of the Social Security Act is amended 20 striking and inserting and 21. SGTP 2 defined. Section 1905 of the Social Security Act is amended by adding at the end the full 24 lowing new subsection 25. 334. SG 2. General. For purposes of Section 31903, except as provided in paragraph 4, the term specified gender transition procedure 5 means with respect to an individual. Any of the full 6 lowing when performed for the purpose of intentionally changing the body of such individual to no longer correspond to the individual's sex. 11. Performing any surgery including 12. Castration, 13 sterilization, 14 orchiectomy, 15 scrotoplasty, 16 vasectomy, 7 tubal ligation, 18 hysterectomy, 19 oophorectomy, 20 ovariectomy, 21 medoidioplasty, 22 clitoroplasty, 23 335 reconstruction of the fixed part 1 of the urethra with or without a 2 medoidioplasty or a phalloplasty, 3 penectomy, 4 phalloplasty, 5 vaginoplasty, 6 vaginectomy, 7 vulvoplasty, 8 reduction thyrochondroplasty, 9 chondrolaryngoplasty, 10 mastectomy, and 11 any plastic, cosmetic, or as 12 phatic surgery that feminizes or 13 masculinizes the facial or other body fee, 14 chures of an individual. Any placement of chest implants to 16 create feminine breasts, or any placement of 17 erection or testicular prostheses. 18. Any placement of fat or artificial 19 plants in the gluteal region. 20. Administering, prescribing, or dis-21 pensing to an individual medications, include 22ing, 23. Gonadotropin-releasing hormone 24 analogs or other puberty block 25. 336. Drugs to stop or delay normal puberty, testosterone, estrogen, or other androgens to an individual at doses that are supraphysiologic than would normally be produced endogenously in a healthy individual of the same age and sex. Puberty suppression or blocking prescription drugs for the purpose of normalizing puberty for an individual experiencing precocious puberty. Medically necessary procedures or treatments to correct for a medically verifiable disorder of sex development, including 46 XX chromosomes with viralization, 46 XY chromosomes with underviralization, and both ovarian and testicular tissue. Paragraph shall not apply to the following when furnished to an individual by a healthcare provider with the consent of such individual's parent or legal guardian. 337. Sex chromosome structure, sex steroid hormone production, or sex hormone action, if determined to be abnormal by a physician through genetic or biochemical testing. 1, 2, 3, 4, 5. Infection, disease, injury or disorder caused or exacerbated by a previous procedure described in paragraph, or a physical disorder, physical injury, or physical illness that would, as certified by a physician, place the individual in imminent danger of death or impairment of a major bodily function unless the procedure is performed, not including procedures performed for the alleviation of mental distress. Procedures to restore or reconstruct the body of the individual in order to correspond to the individual's sex after one or more previous procedures described in paragraph, which may include the removal of a pseudophallus or breast augmentation. 338. Logically determined and defined in paragraphs and respectively. F. For purposes of paragraph. The term female means an individual who naturally has, had, will have, or would have, but for a developmental or genetic anomaly or historical accident, the reproductive system that at some point produces, transports, and utilizes eggs for fertilization. M. For purposes of paragraph. The term male means an individual who naturally has, had, will have, or would have, but for a developmental or genetic anomaly or historical accident, the reproductive system that at some point produces, transports, and utilizes sperm for fertilization. SCC 44,126. Federal payments to prohibited entities. IG. No federal funds that are considered 17 are direct spending and provided to carry out a state 818 plan under Titles X of the Social Security Act or a waiver. 19 of such a plan shall be used to make payments to a prohib. 20. IDed entity for items and services furnished during the 10 to 21 year period beginning on the date of the enactment of this 22 Act. including any payments made directly to the prohib 23-ided entity or under a contract or other arrangement, be 24 between a state and a covered organization. 25. 339. In this section, prohibited entity. The term prohib 2-ided entity means an entity, including its affiliates, 3 subsidiaries, successors, and clinics. 4. That as of the date of enactment of 5 this Act 6 is an organization described in Section 501 of the Internal Revenue 8 Code of 1986 and exempt from tax under 9 Section 50. One of such code, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. If the pregnancy is the result 20 of an act of rape or incest, or 21, 22, 23, 24, 25. Is an essential community provider described in Section 156.235 of Title 45. Code of Federal Regulations that is primarily engaged in family planning services, reproductive health, and related care, and provides for abortions other than an abortion. In the case where a woman suffers from a physical disorder, physical injury, or physical illness, including a life-endangering physical conduct. 340. Caused by or arising from the pregnancy itself, that would, as certified by a physician, place the woman in danger of death unless an abortion is performed, and direct spending. The term direct spending has the meaning given that term under Section 250 of the Balanced Budget and Emergency Deficit Control Act of 1985, for which the total amount of federal and state expenditures under the Medicaid program under Title 6 of the Social Security Act in fiscal year 2024 made directly or by a covered organization to the entity or to any affiliates, subsidiaries, successors, or clinics of the entity, or made to the entity or to any affiliates, subsidiaries, successors, or clinics of the entity as part of a nationwide healthcare provider network exceeded $1 million. Covered organization. The term covered organization means a managed care entity of the Social Security Act or a prepaid inpatient health plan or prepaid ambulatory health plan, as such terms are defined in Section 341, 1903 of such Act. S. The term state has the mean 3 given such term in Section 1101 of the Social Security Act. 5 Subpart C. Stopping abusive financing practices. 6 SEC 44131. Sunsetting eligibility for increased 7 FMAP for new expansion states. 8. Section 1905 of the Social Security Act is amended 10. By striking which has not and inserting 11 the following, which 12. Has not 13. In subparagraph, as so inserted by 14 striking the period at the end and inserting 15 and 16. By adding at the end the following new sub 17 paragraph 18. Begins to expend amounts for all such 19 individuals prior to January 1st, 2026. 20 SEC 413. Moratorium on new or increased Pro 21. Provider taxes. Section 1903 of the Social Security Act is amended by striking or at the end. 342. By striking if there and inserting. By adding at the end the following new subclauses. The tax is first imposed by the state on or after the date of the enactment of this subclause, or on or after the date of the enactment of this subclause. The state increases the amount or rate of tax imposed with respect to a class of healthcare items or services, or increases the base of the tax such that the tax is imposed with respect to a class of items or services to which the tax did not previously apply, but only to the extent that such revenues are attributable to such increase and only if such increase was not pro. 343. provided for in legislation or regulations enacted or one adopted prior to such date of enactment, or 2 SEC 4433, revising the payment limit for certain 3 state-directed payments, or IG subject to subsection. The Sec 5 Retary of Health and Human Services shall revise Section 6438.6 of Title 42, Code of Federal Regulations 7 such that, with respect to a 8 payment described in such section made for a service for 9 niche during a rating period beginning on or after the 10 date of the enactment of this act, the total payment rate 11 for such service is limited to 100% of the specified 12 total published Medicare payment rate. GCP in the 14 case of a payment in Section 438.6 of 15 Title 42 Code of Federal Regulations for which written prior approval was made before 17, the date of the enactment of this act for the rating period 18 occurring as of such date of enactment, or a payment so 19 described for such rating period for which a preprint was 20 submitted to the Secretary of Health and Human Services 21 prior to such date of enactment. The revisions described 22 in subsection shall not apply to such payment for such 23 rating period and for any subsequent rating period if the 344 amount of such payment does not exceed the amount of one such payment so approved. D. In this section, R. Rating period. The term rating period has the meaning given such term in Section 438.2 of Title 42, Code of Federal Regulations. Total published Medicare payment. The term total published Medicare payment rate means amounts calculated as payment for specific services that have been developed under Part A or Part B of Title XV of the Social Security Act. Written prior approval. The term written prior approval has the meaning given such term in Section 438.6 of Title 42, Code of Federal Regulations. F. There are appropriated out of any monies in the Treasury not otherwise appropriated $7 million for each of fiscal years 2026 through 2033 for purposes of carrying out this section. 345. SEC 44,134. Requirements regarding waiver of uniform tax requirement for Medicaid 2-3. Section 1903 of the Social Security Act is amended 5. In paragraph by inserting after 6 clause the following new clause, 7 for purposes of clause. A tax is not considered to be generally redistributive if any of the following 9 conditions apply. 10. Within a permissible class, the tax rate imposed on any taxpayer or tax rate group, explicitly defined by its relatively lower volume or percentage of Medicaid taxable units, is lower than the tax rate imposed on any other taxpayer. Tax rate group explicitly defined by its relatively higher volume or percentage of Medicaid taxable units. Within a permissible class, the tax rate imposed on any taxpayer or tax rate group based upon its Medicaid taxable units is higher than the tax rate imposed on any taxpayer or tax rate group based upon its non-Medicaid taxable unit. 346. That closely approximates a taxpayer or tax rate group under the program under this title, to the same effect as described in Subclub Clause. The term Medicaid taxable unit means a unit that is being taxed within a healthcare-related tax that is applicable to the program under this title. Such term includes a unit that is used as the basis for 347. Medicaid revenue. Costs associated with the program under this title and other units associated with the program under this title as determined by the Secretary. The term tax rate group means a group of entities contained within a permissible class of The term non-Medicaid taxable unit means a unit that is taxed within a healthcare-related tax that is not applicable to the program under this title. Such term includes a unit that is used as the basis for payment by non-Medicaid payers, non-Medicaid revenue, costs that are not associated with the program under this title, and other units not associated with the program under this title as determined by the Secretary. 348 healthcare-related tax that are taxed at the same one rate. ED. The amendments made by 3 this section shall take effect upon the date of enactment 4 of this Act, subject to any applicable transition period to 5 determined appropriate by the Secretary of Health and 6 Human Services, not to exceed 3 fiscal years. 7 SEC 4.5. Requiring budget neutrality for Med 8 IK demonstration projects under 910 Section 1115 of the Social Security Act is amended by adding at the end the following new 12 subsection 13. A requirement of BN neutrality for 14 MP. 15. In general, beginning on the date of 16, the enactment of this subsection. The Secretary May 17th not approve an application for an experimental pilot or demonstra 19 project undertaken under subsection to Pro 20 mote the objectives of Title X in a state unless the Secretary certifies that such 23 project is not expected to result in an increase in the 24 amount of expenditures compared to the amount 25. 349. That such expenditures would otherwise be in the absence of such project. Reapment of savings. In the event that expenditures with respect to a state under a Medicaid demonstration project are, during an approval period for such project, less than the amount of such expenditures that would have otherwise been made in the absence of such project. The Secretary shall specify the methodology to be used with respect to any subsequent approval period for such project for purposes of taking the difference between such expenditures into account. Subpart D. Increasing personal accountability. SEC 44,141. Requirement for states to establish Medicaid community engagement requirements for certain individuals. IG Section 1902 of the Social Security Act as amended by Sections 44103 and 44104 is further amended by adding at the end the following new subsection, CERAI. In general, beginning January 1st, 2029, subject to the succeeding provisions of this subsection, a state shall provide as a condition of 350. Eligibility for medical assistance for an applicable individual, that such individual is required to demonstrate community engagement under paragraph. In the case of an applicable individual who has filed an application for medical assistance under a state plan under this title, for 1 or more consecutive months immediately preceding the month during which such individual applies for such medical assistance, and in the case of an applicable individual enrolled and receiving medical assistance under a state plan under this title for 1 or more months, whether or not consecutive, during the period between such individual's most recent determination of eligibility and such individual's next regularly scheduled redetermination of eligibility, as verified by the state as part of such regu. 351. Larly scheduled redetermination of eligibility. Or 2, in the case of a state that has 3 elected under paragraph to conduct 4 frequent verifications of compliance, 5, with the requirement to demonstrate COM6 community engagement during the period B7 between the most recent and next such 8 verification with respect to such individual. See Immunity Engagement Compliance 10. Subject to paragraph. An applica 11 bull individual demonstrates community engagement 12 under this paragraph for a month. If such individual 13 meets one or more of the following conditions with 314 spec to such month, as determined in accordance 15 with criteria established by the Secretary through 16 Regulation 17. The individual works not less than 18 hours. 19. The individual completes not less 20 than 80 hours of community service. 21. The individual participates in a Work 22 program for not less than 80 hours. 23. The individual is enrolled in an EDU 24 Cational program at least half-time.
Welcome to Executive Order Watch.
The immigrants have arrived.
I know. I have the package.